In this presentation, we will learn about the basic purpose of suctioning, the parts of a suction machine, the different types of suction sources, their mechanism of action, and their practical use in different neonatal units. In addition, we shall also learn the essential requirements which need to be in place before we commence suctioning, the indications of suctioning, the various types of suction catheters, the essential differences between a suction catheter and orogastric tube, the procedure of suctioning, and then the disinfection and sterilization of the equipment which is required for suctioning. We shall also look at some common troubleshoots which will help us to understand how to take appropriate care of the equipment. So, what is oropharyngeal suction? As we know, oropharyngeal suction is a common procedure which is required in the delivery room during resuscitation and also in the neonatal units. It is done to remove secretions from the oral and the nasopharyngeal area of the neonate using a catheter to ensure a patent airway. The basic parts of a suction machine include an inbuilt motor, a vacuum gauge with a precision regulator, suction bottles, these may be 1 or 2 in a particular suction machine, silicone hose or a silicone suction tubing, a bacterial filter, and an overflow safety valve. The foot operated suction machine, on the other hand, is a simple device which has a suction tubing and a suction bottle with bellows adjacent to it, and these bellows are foot operated. Let us now look and understand the parts of a suction machine in a little more detail. The antibacterial filter is located in line between the suction collection bottle on one hand and the inlet suction housing on the other hand. It protects the patients and the practitioners from harmful body fluids that may contaminate the vacuum regulators, the wall outlets, and the pipeline systems. It reduces infection risk, keeps the equipment clean, and extends the useful product life. Here we see the suction hose or the silicone suction tubing. The suction bottle is a chamber in which the secretions are collected during the process of suctioning. It has clear markings displayed on it which tells us the volume of the secretions collected in the bottle. It has to be cleaned after use. The vacuum precision regulator regulates the amount of vacuum which has to be created during the process of oropharyngeal suctioning. Now let us look at the overflow safety valve in a little more detail. Let us now look at the overflow safety valve. The overflow safety valve prevents damage to the pump by closing the suction system in case any moisture enters the valve. Hence, it protects the suction system. We should also know about the different types of suction sources available to us. There are basically 2 types of suction sources. First is the wall suction and then is a portable suction machine. We shall discuss about them in detail in the subsequent slides. First, the wall suction. The wall suction is connected to a central suction source. Nowadays, it is frequently used in the special neonatal care unit. It is connected by pipes to various points in the hospital. As the name suggests, it is attached to the wall and hence is not portable. It is having a manometer attached to it to adjust the suction pressure and is connected to the vacuum port on one side and to the suction tubing on the other side. There is a separate on and off switch. It does not require any electricity but requires a constant suction source for working. The main disadvantage is its high cost, otherwise it is very easy to use. Now, coming to the portable suction machine. They are basically of three types. First is a foot or a hand operated machine. The second is an electrical operated machine, and the third is Venturi, which is a common system in the portable suction machines. The foot operated suction machine. These machines require physical effort and are less powerful, but they are very useful when electrical supply is erratic. The foot suction machine works on the principle that when the bellows are compressed, the air is forced out in the upper part of the bellows. And as the bellows re-expand, a vacuum is created, and this vacuum transfers the secretion from the patient to the beaker, as shown in the figure. The most effective result is obtained by the regular rhythmic compression of the bellows. Few important considerations while using the suction machine include that the right foot has to be placed on the bellows have to be pressed down, ensuring that they come in direct contact with the central vertical metal plate. The foot pressure can be adjusted to ensure adequate suction. Some foot suction machines also have a manometer attached so that the pressure can be regulated. Among the electrical operated portable suction machines, we have primarily of two types. The low flow low vacuum type, which can generate pressure up to 100 mm of mercury, and the high flow high vacuum type, which can generate pressure up to 760 mm of mercury. The approximate cost of these machines varies from 40,000 to about 2 lakh Indian rupees. The third type of portable suction machine is a Venturi suction machine. These are usually attached to the imported resuscitation trolleys. They are very useful when there is failure of electricity, but most of them require a continuous flow of oxygen to run on. The principle of Venturi. The Venturi works on the principle that when air or oxygen flows under pressure through a nozzle and comes to a large bore tubing in a sealed bottle, it creates a negative pressure or a vacuum. This vacuum in turn leads to active suction of the secretions from the patient and hence leading to suction. Another common example of a portable suction source is a Deeley strap. This strap is used to suction the airway in low resource settings where suction machines are not available. It has two tubings, one tubing which is placed inside the patient's mouth, while the other tubing is used to create negative pressure by suctioning with the mouth of the caregiver. The oral suction trap is less advisable because of the risk of transmission of infections from the secretions. Let us now discuss the important indications of oropharyngeal suctioning. It is important to know that suctioning is not routinely recommended in all newborn babies. It is indicated in specific situations. These include: number 1, when the baby is not able to clear the oral or the nasal secretion on its own. For example, a baby with hypoxic ischemic encephalopathy, or a baby with esophageal atresia with tracheoesophageal fistula, or a baby who is very premature. Secondly, prior to bag and mask ventilation and endotracheal intubation so that positive pressure is effectively delivered to the baby's lung. Number 3, when there is milk in the airway and we have to prevent aspiration pneumonia. And last but not the least, after chest physiotherapy to remove the secretions which traverse from the lower airway to the upper airway. Before suctioning, we should know the articles which should be available bedside to facilitate suctioning. This includes a pair of gloves, normal saline or sterile water, suction catheter of appropriate size for that baby, and a bag and a mask. In addition to the previously mentioned things, it is very essential to have an oxygen source available to us, because during suctioning the babies may have hypoxia, cyanosis or apnea. First, let us discuss about the suction catheters. We should know how to select the appropriate size suction catheter, and more importantly, how to identify a suction catheter. Suction catheters are available in various sizes from 5 to 14 French. In preterm babies, the size of suction catheter generally used is 5 French and 6 French. In term babies, we use 8 French and 10 French. For meconium stained babies, especially in case of thick meconium, a large suction catheter, generally 12 French or 14 French, is used for babies born through meconium stained LICA if they require suctioning. The problem with a small or a large size catheter is inadequate suction or trauma, respectively. There is a specific color coding for the different sizes of suction catheters which are available to us, and this slide you can see the various types of suction catheters which are available commonly in the hospital. You can identify the catheter size by seeing the color code as is shown in the picture. A suction catheter is identified by some characteristics. It has a blunt end and an opening on one side. On the other hand, it has a knob which is used for applying suction. Earlier, the suction catheters which were available had no markings, but these days catheters having markings are available and should be used for suctioning. It is very important to differentiate a suction catheter from an orogastric tube. As we can see here, orogastric tube is having a closed end with two openings on the side of the tube. Orogastric tubes are also radio-opaque, and hence we can distinguish a suction catheter from an orogastric tube. Now we shall discuss about the different steps of suctioning. The first and the most important step is proper hand washing, and this we all know is the first important step to maintain asepsis. One should follow appropriate hand hygiene protocol and then don on a pair of sterile gloves. After this, attach the appropriate size suction catheter to the suction tubing. Now, the most important step is to set the suction pressure. First, we have to check the position of the needle in the manometer when the suction pressure is switched off. It should be at 0. Once we switch on the suction pressure to the maximum, the pressure should be set at 100 mm of mercury. The suction pressure routinely required for suctioning varies from about 80 to 100 mm of mercury. Important step in addition to this is to check the tubing for appropriate suction pressure and build-up. After setting the suction pressure, the desired length of the suction catheter is measured from the tip of the nose to the tip of the ear. Commonly, for oral suction, the desired length is about 4 to 5 cm as compared to a 3 cm length in case of a nasal suction. The important thing that we should know is that suction pressure is to be applied only when taking out the suction catheter. Never apply suction while you are inserting the catheter, because If a suction is applied during insertion, then it would lead to tissue trauma. You have now done the suction, and what to do now? The suction catheter should be cut and disposed of in the blue bag or as per the hospital recommendations. It should never be reused. Some do's and don'ts while using suction catheters for oropharyngeal suctioning. Always do gentle suction in order to prevent tissue trauma. Maintain asepsis by proper hand washing and face mask. Use disposable suction catheters, and prior to suctioning always check the adequacy of suction pressure. One should avoid vigorous and deep suctioning while doing oropharyngeal suctioning. Some important points that we should know are: suctioning should be avoided for 30 minutes to 1 hour after feeding unless it is very essential to establish a patent airway. Suction only when it is required. Routine suctioning is to be avoided. Vigorous suctioning leads to apnea and bradycardia and hence should not be done. Do not exceed a suction pressure of 100 mm of mercury. This is approximately equal to 130 cm of water or about 13 kilopascals. Some machines have their measurements given either in centimeter of water or in kilopascals. One should remember that 1 mm of mercury is about 1.3 centimeter of water and 1 kilopascal is about 7.5 mm of mercury. Having learnt the steps of suctioning, let us understand the basic principles of disinfection and sterilization. The suction bottle and the tubings should be placed in Sidex for 4 to 6 hours for sterilization. Wash them thoroughly with distilled water, rinse and dry. The fluid jar can be autoclaved at 124 degrees Celsius or washed with soap and water. It is important to remember that the fluid jar should be immediately emptied when it gets filled to more than half the mark displayed on it. Having learnt the basic principles, the functioning and the disinfection, let us now try and understand some common problems which may arise during the functioning of this machine. If the machine does not suction as per requirement, check for the following: the adequacy of suction pressure. Check the tubing. It could be leaky or it could be broken. Check the fuse, the cord and the earthing. Sometimes the fluid jar may not be emptied immediately. So, to prevent the overflow of fluid into the bellows, open the alternate suction inlet. What to do if the unit does not turn on? Check the power source, check the connection. Ensure that the wall outlet is functioning. Check the power cord. It could be damaged. Another common problem which one may encounter is that the motor is running but the machine is not creating a vacuum. Again, check the tubing connection whether it is secure. Check for leaks or kinks in the tubing and check for bottle leaks and bottle cracks. If the machine suggests a low vacuum, adjust the vacuum knob to increase the suction pressure and check for the system leaks or any breaks. Finally, we understand that suctioning is not to be done as a routine procedure in all newborn babies. It should be done only when required. The upper limit of suction pressure is 100 mm of mercury and the suction has to be applied only when you are taking out the suction catheter. Thank you.